A very good morning to you. How are you doing? I hope that you're fine, you're blessed, you're happy. Happy new month. Tumekuwa tukisema we're just about to get to the second half of the year and you're finally here. Yani tushamaliza the first half of the year. The other day I was saying, ilikuwa ni juzi tu wali were saying, oh, Happy New Year. In fact, there are people who are still saying Happy New Year. So it has been an amazing first half of the year, with so many challenges here and there, but also so many blessings. So we thank God that we've been able to see this particular day, and He's blessed you, and He's allowed you to be alive today. So that's a reason to thank the Lord. Karibu sana. This is MBCI TV, ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is none other but Afya Clinic, where we talk about everything health. We make sure that we simplify every topic in a way that would be able to understand and relate, and make sure that if it's an issue that you're going through or a friend of yours is going through, you're able to just understand what that is and to be able to help them and support them as well. So today we'll be having an amazing conversation. But even before we go there, let me invite you warmly to this amazing show. Thank you so much for being here. Thank you for choosing to watch MBCI TV. We do value your time greatly. My name is Rachel Kahugo. We'll be here up to 10 a.m. and we'll be happy to hear from you. So our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages at Rachel Kahugo. Nitaweza kupata ujumbe wako loud and clear. Once again, thank you so much for being here. Now, since it's new month, I'm almost saying Happy New Year. I don't know why this second half of the year sounds very exciting. I hope that it will be a blessing. And I pray that it's going to be a blessing to all of us. Yeah? But because we've gotten into the second half of the year, and this is our very first show, for that matter, for our second Happy New Year, I'd love to know what you're thanking God for. We've had an amazing, najua kuna vitu mingi zimekuwa zikihappen, but you've had an amazing first half of the year. Now I'd want to know, what are you thanking God for? I know there's a reason. Utakati if you say, as much as you've had these and these and these, there's so much to thank God for. So I'd want for you to share with us through our numbers that I've just shared, but pia tuambie wewe ni nani, unatuwatch kutoka wapi, unatuwatch na kina nani. We'll be happy to hear from you. How has your first 6 months been, but also how has your week been since tuachane hapa on Wednesday? So tell us about that and we'll be happy to hear from you. Today we're talking about sickle cell disease. Na najua kuna watu wengi ambao wanaijua kama sickle cell anemia. And we've had some of you viewers mentioning it not once, not twice, and he said it's very important for us to talk about it just to understand what exactly that is. So we'll unpack that. If you have any question, please feel free to ask. And we have our doctor with us already in studio. He's not a very new face in studio, tumekuwa na yeye, but tukushtaki ama tuache kwanza. We just get into the discussion. Now, we'd love to introduce to you the doctor that you're having to just unpack this particular discussion. And for that, we'll be getting into the guest profile so that you'll be able to know the doctor that you're having today. And after that, we'll be getting into our discussion of the day. Others, karibu sana. For now, maybe let's get the in history segment kwanza so that you'll be able to just understand what exactly is sickle cell disease. Before we even get to a doctor who will be helping us with this particular conversation, let's get to the in history segment for you to be able to understand what exactly is sickle cell disease.
Sickle cell disease, SCD, has a rich history dating back thousands of years. This condition was first described in Africa over 3,000 years ago, with evidence of its existence found in ancient cultures in West Africa, where the sickle cell trait HBS is most prevalent. In the early 20th century, the disease was formally identified by the American physician James Herrick, who described the characteristic sickle-shaped red blood cells in a patient. The genetic basis of a sickle cell disease was later elucidated in the 1940s and 1950s with the discovery of the mutation in the hemoglobin subunit beta HBB gene that codes for hemoglobin. This breakthrough led to a greater understanding of the disease inheritance, patterns, and paved way for genetic counseling and screening programs. In the later half of the 20th century, advances in medical care, including blood transfusions, antibiotics, and pain management, significantly improved the life expectancy and quality of life for individuals with sickle cell disease. Today, sickle cell disease is recognized as a major public health concern globally, particularly in sub-Saharan Africa, where it is estimated that over 75% of births with sickle cell disease occur. Efforts to combat the disease focus on early diagnosis, comprehensive care, and research into new treatments such as gene therapy and targeted therapies. Additionally, initiatives to increase awareness, reduce stigma, and promote genetic education are underway to improve the lives of individuals and families affected by sickle cell disease.
Alright, so that is it about sickle cell disease. Na najua umelewa kidogo, at least you have an idea of what exactly that is and the history of sickle cell disease. And now, we'd want to introduce our doctor for the day so that you'll be able to just relate with who we'll be having this discussion with. So let's get the guest intro and then we'll be coming right back into the discussion. Today on Afya Clinic, we are joined by a passionate health professional whose mission is to serve humanity through accessible and quality healthcare. Dr. Stephen Mutemi is a seasoned entrepreneur, clinician, and a certified sonologist with over 10 years of experience in general clinical practice and ultrasonography. He is committed to bridging healthcare gaps. He is the founder of ClearScan Medical Solutions, a private clinic located in Lydia Arcade, Kenyatta Avenue in Nakuru, where he provides expert medical consultation, ultrasound services, and cervical cancer screening at affordable rates. When he's not in the clinic, Dr. Stephen enjoys good food, engaging. Today, he joins us to shed light on sickle cell disease, what it is, how it affects the body, the role of diagnosis. All right. So that is it, and we're very happy to have you here. Karibu sana.
Asante sana, Rachel.
It's been a minute.
It's been a while.
It's been a while.
And I'm happy to be back.
Asante sana. You've been well?
Yeah, I've been very okay.
ClearScan kukoaje?
ClearScan tuko sawa kabisa. Tunahudumia watu kama kawaida wa Nakuru.
Amazing.
Na tunashukuru.
Asante.
Yes.
Thank you for being here. I know you are a very familiar face on MBCI TV, especially the health show. But for the people who are seeing you for the very first time, just say hi to them. That's your camera.
Hi, hello viewers, and welcome to this segment. And I welcome you to work with us so that we can learn together about sickle cell disease.
Asante.
Yes, of course, they say I wear many hats.
Yeah.
When I'm not doing scans, of course, I'm treating. But most people don't think that I treat because I do most of the scans. Yeah, and nashukuru Mungu because amenipatia uwezo kukua all around.
Yeah.
Yes.
Why did you specialize with the scans? You know, that's a very, very particular area. Yeah,
sure. As you said, it's a specialty, and I was pushed by the need that I saw in the clinical practice. Of course, before the scans, I was doing general practice, and I identified that as a gap, and I saw it as an opportunity to bridge the gap. That's why I went back to school, specialized in ultrasonography. Yeah, and that's why I'm here. And I'm happy with what I've been able to do in Nakuru and beyond. For the last 8 years, I've been doing scans specifically. It gives me a lot of pleasure and a lot of satisfaction to see the difference that I'm making in the society.
Yeah, that's good. We'll be talking about ultrasonography. I know that's a huge topic there. So very soon we'll be talking about that. And you know, what are the scans that people need? A mother who's expectant, what are the stages of the scans? Ni moja tu ile, you know. So I know that's a really huge topic. We'll be talking about it. But today we're talking about sickle cell. And this is a topic that lately has been on the limelight. We need to unpack why as well. But before we even go there, sickle cell ni nini?
I will try to make this discussion as simple as possible. I think I will apply my teaching skills on this one.
The teaching skills as well, when you wear many caps.
I am a lecturer and, and a long-time examiner. So I'll try to make it as simple as possible. And the way I like putting things for my clients and my patients, because I usually believe that when it comes to patient care, it's not about the knowledge that I have, there is no way you're going to take care of a patient or a client without the client understanding what you are doing for them.
Okay.
So when they understand what you are doing and what is happening to their bodies, and it becomes very easy. And the reason I'm saying that it's very important for the patient to understand is because, for example, for sickle cell, the management or the care of the patient is two-way. There is what the doctor is doing or the clinician is doing, and there is what the patient needs to do. And you realize that as we are going to go through the discussion, you realize that there is a lot that needs to be done by the patient. Okay. So it's a good thing that you thought about having this discussion so that we can help the patients and we can help even the general population to be able to identify and help manage these patients. So you asked me what sickle cell disease is. Yeah. Now, sickle cell disease is a disease that basically it's inherited or a genetic problem. Right? That means that it has to be transmitted from the parents, or it has what we call family lineage. So you cannot get sickle cell disease by staying close to somebody who has sickle cell disease. Yeah. So it has to be linked to the genes. And all of us, our bodies are genetically engineered. So there is a gene that codes for everything. It's like the body map. Yeah. So this one specifically that results to sickle cell disease, as you said in the intro, it was a very nice intro, that it affects the genes that code for hemoglobin. Basically, hemoglobin is the component in the blood, which is in the red blood cells. The red blood cells now, at least hapo tunakutana kila mtu tunajua hiyo inabeba oxygen. Yeah, so in that red blood cell there is that component or the protein complex called the hemoglobin. That one that carries now the oxygen per se. Okay. So what happens to the genes that in that hemoglobin is that it is altered. Yeah. And when it is altered, there is a certain segment of that gene that is altered, ama inabadilika, inakosa kuwa vile inafaa kuwa. Now, you had asked me about the other variants of sickle cell. Sickle cell disease encompasses 3 variants. There is the sickle cell disease per se, the sickle cell anemia. There is another variant that is hemoglobin SC, and there is what we call beta thalassemia. Okay. Those ones, they don't have what symptoms? They don't have symptoms, just like the sickle cell anemia. Now, having explained the genetic background of it, it is also important to know how it came about. In your intro, you mentioned that it was discovered long time ago, 100 years ago. Yeah. It was described like abnormal red blood cells. Yeah. They described the anemia. They described the splenomegaly that occurred because of the same. Now, maybe
before you go to the history and where it first came from, because I know most of us want to know, hey, atakama it's hereditary, ilitoka wapi. But you've told us about the different variants. Maybe what's the difference between the different variants of sickle cell?
Now, the difference is the effect of the variation on that gene on the hemoglobin. Okay. Yeah, and I said that like the hemoglobin SC and the beta thalassemia, they also tend to bring up the issue of anemia, but are not as bad, and the symptoms are not as bad as that of the now sickle cell anemia per se. Okay. Of course, I told you anemia is just a symptom. Yeah. The others are not common. Yeah. What is common and what is most prevalent is now the sickle cell anemia. Okay. Yeah. So most of the time you'll come across the sickle cell to be sickle cell anemia. Yeah, most of the time. Yeah. Okay.
But zote, all the variants, they all affect the red blood cells.
Yeah, they all affect the red blood cells. Okay, the hemoglobin per se.
Okay. Yes. Perfect. Now let's talk about ilitoka wapi.
And now, if you read a lot of literature, it says that there is a very close relationship between sickle cell disease and malaria endemic areas. Yeah, and that's why in your intro you talked about it being common in the sub-Saharan Africa in the tropics, and you see in the tropics where you have a lot of malaria. Yeah. Now, if you narrow it down to Kenya, there are those areas that we know they are malaria endemic areas, the coastal region, the western region, and Nyanza. So it is thought that the body was trying to fight malaria, and that's why that mutation came in.
Okay.
And that one is evident because now when you talk about sickle cell, there is what you call now the sickle cell. There are the people who have the sickle cell hemoglobin.
Okay.
Those will be having the disease, and others will not be having the disease.
Okay.
So the ones who are carrying the disease, or one of the genes are usually two. So what you call now those who carriers, they are having the sickle cell trait. They are carriers, but they don't suffer the disease.
Okay.
Then if you have now the two genes in your body, then now you suffer sickle cell anemia. Now, for these people who have the trait, they are resistant to malaria. And that's the reason why, yes, from the research, it is shown that those who have the trait or the carriers, they are resistant to malaria. And that's why now it is thought that it occurred as a natural selection. The body was trying to fight this thing called malaria, and then it came up with now the mutation, and now the mutation ended up with the sickle cell gene mutation. Now having now the trait and the sickle cell, the disease. So there are people who will have the sickle cell trait, but they will not suffer the disease.
Okay.
But they also
so these particular people who have the trait but don't suffer the disease, they can't get malaria.
No, they can, but they have a lot of resistance to it.
Okay.
Yes, they have resistance to it. They cannot easily get malaria.
Okay.
Not like the person now. Now the inverse of that story is now the other person who has now the disease, they are highly prone to malaria. Yes, that's why in our management we talk about the relationship and what we need to do to avoid that, because now the ones who have the trait, they're okay. The ones who have the sickle cell, the double gene of hemoglobin S, they have a problem.
Okay.
When it comes to malaria, yes.
Yeah, and maybe, I don't know if it's possible, the director, maybe we can get photos of what the mutation looks like. A normal red blood cell and the one that has mutated.
Now, what would be more relatable to that discussion is when now the hemoglobin mutates. We usually have a normal red blood cell, which we usually say is biconcave. Now we can have an image of a biconcave red blood cell, and now we can have an image of a sickled red blood cell, because now the sickle comes from the appearance of that red blood cell now when it has been affected or the genes have mutated. And of course, if it's in its normal environment, it will not sickle. There are those things that will now trigger now the cell that has the wrong or the hemoglobin S or the sickle cell to change the shape, because that is what now brings about the entire thing. All the symptoms and everything usually results from now this red blood cell sickling. It appears or it takes the shape of a sickle. The sickle ni ile tulikuwa nasoma kwa agriculture ya kukata nyasi. So the way it appears, that's the sickle. So that's why the name sickle cell anemia. So what happens is that now when this red blood cell is subjected to now the unfavorable conditions, it changes the shape. But ideally, a normal red blood cells is usually biconcave. So there are now the advantages of the red blood cell being biconcave and the disadvantages of the cell being the sickle shape. And it's very simple. When you have the cell, which is a biconcave in shape, it is easily deformed. You see, the blood vessels, to pipes, tuko kwa damu, tuko kwa body tunapitisha damu, and you see they start big, and as they go down the tree, they go dividing and becoming smaller at the level of the capillary. It's a very tiny thing. So for this red blood cell to pass through these capillaries, to get to the last part of the body, the toes, to deliver that oxygen there, it has to maneuver. So when it's in this biconcave shape, it's able to deform and get into that shape, and then come back to the heart. Now, when it is sickled, it gets a bit rigid. It cannot change shape. So what will happen when it gets to those very small vessels? They clog. Yes, and now that's where now the problem begins.
Okay, now I'm getting it. Now, my question would be, if it happens that the cells is in a clog, it means that the blood that is now moving, high no oxygen.
It is not able to deliver the oxygen. It's not able to dissociate. See, what happens is that when this hemoglobin now it's carried in the red blood cell. When it gets to the tissues, it is asked to dissolve the hemoglobin, and it's that is carrying the oxygen now. It has to dissolve and dissociate. Lets the oxygen to the tissues, and now takes the carbon dioxide and goes back to takes to the heart for ifike lungs itolewe ikuje huko hewa. Now that dissociation, that solubility is what is now affected. That's one of the things that, not only the thing, but one of the things that is affected.
Okay.
That now this hemoglobin that which is Sickle, it is not able to dissolve. It does not dissolve easily, so it's not able to dissociate to let the oxygen get into the tissues. That is one of the aspects. Okay. Now the other aspect is when they clog. It's like a pipe ya maji umefunga. So damu ifiki huko chini. So those tissues go huko chini hazitapata damu. Yes. Now again the other symptom comes in, which I'm going to explain as we go along. Yes. And how those comes. Yes.
Okay. Now we'll be getting to just see what are some of the symptoms. Good thing we now understand why the symptoms would be happening in the body. But before we do that, let's just get the images so that we'll be able to understand how a normal red blood cell looks like. Yeah. So we have the image there. Please explain.
Now, you seeing the small dots there. Those are now normal red blood cells. You see it's appearing round. But now, if you were to take it at a microscope now in a close range, it will appear by concave. That's one side is caved and the other one is caved. So that one is a normal red blood cell there. Okay. But there is another one there. You can see it's looking like a sickle. I don't know if you've ever seen something there that is not looking like a normal red blood cell. That's what we are talking about.
Okay. Yeah. Okay. So what happens when one has the sickle cell disease? It's that it's not all the red blood cells that are sickled?
No, not all of them. Not all. It's just a percentage. Okay. Yeah, it's a percentage. But now you find that now most of these now red blood cells, now the greater percentage has a problem. Okay. Yeah. You still find like now the HBSC, the one I was talking about. You find like 20% of those red blood cells are affected. That does not mean that all the cells are affected. So when you get the majority of, now you see now the sickles there are so many. But you still have normal red blood cells. And that's why now these people are able to survive, right? Okay. That's why they are living. Otherwise, if you had all of them sickled, then that is the end of it.
Unaenda.
Yeah, you unaenda.
Okay. Yeah. I hear you. Now, let's go to the symptoms. What are some of the very common symptoms of sickle cell disease?
Yeah, before we get to the symptoms, there's something that I've remembered and it's very important. I don't know how you came up with this decision to discuss sickle cell disease today. Apparently, June is the sickle cell month. Not the month entirely, but the date that we need to celebrate or to recognize sickle cell is 19th of June, before I forget. So it's the right decision, the right topic, the right month.
We've actually seen people on the internet as well. Just creating awareness about sickle cell, which I think is a really, really important thing. So this tells you that you should be sharing the link so that people will be able to understand what sickle cell is. Exactly. So
19th is the day, the awareness day for the sickle cell disease. Now, the symptoms, the major symptom, and that's why most of the time people will talk about sickle cell anemia. The common symptom is anemia per se. What is anemia? Anemia is a state whereby you have now reduced hemoglobin. Ama now hiyo component ya damu yenye inabeba hiyo oxygen inapungua. Unaona? So that's why we talk about sickle cell anemia. But there are other things now that will come as a result of now the anemia per se. This includes other now the anemia, we have the pain. What we call several crises. We describe them as crisis. And now this crisis results now from what I was trying to explain. We have what we call the acute chest syndrome. We have what we call anaplastic crisis. We have what we call splenic sequestration. Those are big terms, but I'm going to explain that. To make it simple, let's discuss anemia, because anemia now, the anemia symptoms is what is more prevalent. And we have said anemia is a reduced blood level. So most of the time, you will find that what might trigger the doctor or the person who is seeing, or the healthcare provider, to think about the sickle cell first might be now the anemia. The patient comes unamwangalia clinically, unaona hii patient mbona damu yake iko chini. You try to rule out other things which can cause now the anemia, like bleeding and all the other causes that lead to anemia. You find that you're not there. Then now you have now what you call a high index of suspicion, because you've taken the history. Of course, this person tells you they come from where. But that does not mean now the sickle cell anemia is limited to those coastal areas, the Nyans and Western, because people have traveled. There are people who are from Western, they live in Nakuru. Others are from coast, they live in Nairobi. So the spread has been a bit the spread equal widespread because of people are now moving at all. They are not remaining where they were born. That's why you need to, everybody, any healthcare provider should have the high index of suspicion. So as I was saying, the low blood level, right? How does it happen in sickle cell? What usually happens is that normally a red blood cell has a life span of 120 days. So every cell is like 120 days. But the good thing is that we are generating new ones. Now, because of the hemoglobin S or the sickle cell anemia, these cells that have been deformed, they are easily destroyed. Because they are of abnormal shape, and that's how the body does. When you get to the 120 days expires, the body detects that this cell imechoka, inaimalizana nayo. But the good thing is that now the iron that is in that red blood cell is taken back to the body and is reduced to generate another other cells, red blood cells from the bone marrow. So these ones that are deformed, they get destroyed very fast. So they don't get to the 120 days. So what's happening? So you are reducing them very fast beyond the normal rate that is supposed to they need to be reduced. So that's why we end up with now low blood level.
And they're not regenerating as fast as they should?
The regeneration could be as fast, but the destruction is faster than the regeneration. Yes. But again, they also have now the other aspect is now the pain. The pain I was talking about. This pain can be in the chest, can be in the joints, can be in the bones.
Why?
Now, this is the reason. I told you that oxygen is delivered to every part of the body by the HB. Now, what happens is that because what we call the post-venous capillaries, the terminal, the last part of the blood vessel, where the capillaries are, that's where now the oxygen is delivered. Now, because of the sickle cell disease, I told you that the red blood cells, they become less soluble. It also affects the lining of the blood vessels. So what will happen is that there is that viscosity, ama ile uzito wa damu. Uzito wa damu, nazamanga damu ni zito kuliko maji. It is true. When you describe it in terms of viscosity, there is that thinness. Watu wamepika uji wanajua kuna uji ile uzito inafaa kwa nayo, then kuna ile light. So there is that specific, that's not viscosity. I'm trying to explain what viscosity is. Kuna hiyo uzito yenye inafaa kuwa the right uzito, ile damu ndio iweze kupita kwa mishipa ya damu vizuri. So you can imagine ikikuwa mzito sana. What you call increased viscosity. Ikikuwa mzito haitaweza kupenyeza kwa zile mishipa za damu yende ifike mpaka kwa kale kadogo kabisa. So what happens is that now because haiwezi fika, they clog. And because of the shape again, zinashikana. Zikishikana zinaziba. So now that part, that distal part, ama that part ya mwisho ya hiyo mishipa ya damu haitakuwa inafikiwa na damu. Any other part of the body that is not receiving blood, that thing is very painful. It's extremely painful. Now that part can be anywhere in the body. It can be in the bones, can be in the lungs, can be in the abdomen. But specific parts are not receiving blood. So it becomes very painful. Just as if you kechukua kitu, you tie your finger here. Na ikae hapo kwa muda mrefu, you'll be in a very bad pain. What we call excruciating pain. So those small parts of the body that are not receiving enough blood because of the clogging of the red blood cells, the increased viscosity. So that's how now the painful crisis come in. And now that also brings the other symptoms, because you'll find that there are other symptoms that will be related now to that aspect of blood not reaching every part of the body. And that includes the nervous system, the brain. You can get what we call cerebral infarct. Some parts of the brain they are not receiving blood, so they start atrophying.
Okay.
The same thing with the eyes. You get person now having sickle cell, they have issues with the eyes. Then they have issues of growth, what you call growth retardation, delayed mental development, retarded growth generally, because the parts of the body are not receiving
blood,
enough oxygen, and it's because, one, there is no enough red blood cells to carry that oxygen there.
Yeah.
Number two, they get into those crises that cause micro infarcts or dead, or the lack of blood reaching, or the blood reaching those very, very specific areas, and it can affect any part of the body. It's only that now there are those peripheral parts, the toes, the fingers, that's for the young ones, the skin, because the other symptom that usually find or sign is that they will have what we call chronic leg ulcers, ama vidonda as a pony. That's a very common presentation. Of course, I've followed many patients with I've seen many patients with the sickle cell. I have followed many, and of course, I've come across all these things. Yep.
Now that you've explained that, and you've said that you've seen many patients with sickle cell, not the exact, but what's the rate? Is it something that is alarming?
It is alarming because annually the prevalence of sickle cell disease in Kenya, we are talking about 14,000.
14,000 is huge.
Every year. It's a large number.
Yeah.
It's a large number. That's why now the awareness, we need to create the awareness so that we can be able to do what we call, now what we are advocating for recently is a comprehensive care for these people or the patients who have sickle cell. Yeah.
Okay. And you're coming there because I know we need to just understand what the treatment looks like, or how would someone who has sickle cell be able to live a normal life. But before we do that, let's get the vox pops. We'll need to know what you know about sickle cell, because you say that this is the month that we also just raise awareness, and we'll be talking about these each and every other Wednesday, just as we did with Mental Health Awareness Month. We'll not be talking about sickle cell every Wednesday, but we'll be mentioning it. If you have any question, we'll be able to answer. But for today, we'd want to know, is there a need for more sensitization? So for that, we would want to hear what you know about sickle cell. Now, let's get the vox pops, and then we'll be coming right back.
What I know about sickle cell anemia is that watu wako na sickle cell anemia ni watu wenye nini red blood cells yao ni C-shaped. Ni C-shaped, alafu ina affect hemoglobin na circulation of oxygen kwa body.
Okay, sickle cells huja kwa mtoto wakati kuna genetics kwa blood huwa ina rai ndani ndio inaleta ya sickle cell. So kuna wakati inatakana aende physiotherapy ndio at least arudi, sio kurudi normal, lakini at least akuwe flexible hizo mwili, na mostly inaanza na kuconverse kwa mtoto mapema akiwa early age, anaanza kuconverse, alafu baadaye kuna kunini viungo zinakuwa numb, ndio sasa ina affect mpaka movement ya mtoto na growth ya mtoto anakuwa na milestone.
Acha ni characterize kwa watu wenye wanakuanga na wanainfectiwa na sickle cell. Wale watu wenye uko na ukipata mdomo sawa hapa hivi ni red, and red sana. Unadhani kama wamechomeka, unaona. Alafu sometime hao watu wanapumua deep sana. Yaani utadhani kama mtu mwenye amekimbia, lakini anapumua naturally.
Nitaweza sema sickle cell ni ugonjwa wa damu ambao za zingine kwa mwili huwa inakukata nguvu zote, na itaweza leta kitu kinaitwa clot. Sasa hapo ukisapata clot, kitu cha kwanza au amuki, kitu kingine haufanyi chochote, yani unakaa restless, unalala kwa nyumba, huwezi fanya chochote. Hiyo ndio aina ya hiyo sickle cell ambayo ninajua, ambayo kwa binadamu huwezi, kama umeadhiriwa na hiyo ugonjwa hakuna kazi utafanya.
Sickle cell anemia ni hali yenye mtu anakuwa nayo kwa damu, ambapo damu yako inakuwa na the sign of a single cell, a single nini hiyo msumeno ya kukata nyazi, which means kwa kila msipa damu inakuwa na hiyo sahihi, yani that thing. I think it causes the loss of blood in the body.
Doc, what do you have to say about that segment?
I'm happy. I'm
Yeah.
impressed.
Yeah.
I'm impressed that at least people are aware of what sickle cell anemia is and how it comes up. I'm very impressed.
Yeah. We could see as the segment was continuing, you'd say, yeah, that's true. That's true. But there's someone who mentioned about the clotting and inafika mahali and you're told you can't even move and now you have to stay in bed, unakuwa bedridden. Inaweza fika hapo?
Yeah, it can get to that stage. As I said, if you're having a lot of clogging into your, you should start in the smaller vessels, so you can get into the bigger, the larger vessels. Then because of that clogging or increased viscosity, you end up with what we call stasis.
Okay.
If you have stasis, that is one of in the triad of thrombosis. It's one of the things that causes now what we call thrombosis. Thrombosis is a clot.
Yeah.
That clot now completely blocks that blood flowing to the other part. And if it affects a major vessel that supplies a certain organ, for example, it could be your lower limb. If, for example, you have a clot at around the knee joint, one called the calf, hiyo mguu inakuwa na clot. That clot can also be in one of the major vessels of the brain, like the mid-cerebral artery. If you get a clot there, that part of the brain that is supplied by that blood vessel, again, it gets infected, it dies. They get what we call now stroke, because again, stroke is another sign or the sign and symptoms of sickle cell. As now, this comes now as complications if you don't take care of the sickle cell patients appropriately. So it is true. Getting a clot, one is because of increased viscosity, stasis. Then that is a very good. The other thing that, as I told you, the inner lining, what we call the endothelial lining of the blood vessels, what we call intimal injury, because of other changes in that in the red blood cells. Something called the nitric oxide that control the flow and the stasis and the viscosity and all those things. Now, you have stasis, you have endothelial damage. That's two things that usually precipitate to or predispose you to getting now the clot. So yes, clotting is one of the things that can come up as a complication of sickle cell disease.
Okay. And that was very well explained. I hope that you've gotten that and gotten that very clearly. Now, I see we have around 8 minutes to go for a break, but it would be very important for us to also talk about this. There's something you had mentioned that, especially in kids, when they get the numbing of the toes and the fingers, does that mean that sickle cell it shows differently in adults and kids, or is it just the same?
Majorly, I would say that the symptoms are almost the same, but there is some difference in the way the patients will present. Basically, it's important for me to mention here that the symptoms, the signs and symptoms will start to appear from 6 months to 1 year after birth.
Okay, why?
The reason is very simple. When the baby is growing in the womb, they have a different type of hemoglobin, what we call hemoglobin F.
Okay.
For us, we are running with hemoglobin A, right? Now, because the baby has been born, they are still using a lot of hemoglobin F, which now starts to depreciate or to reduce as the baby grows. So by the time they are getting to 6 months to 1 year, now the adult hemoglobin is starting to set in, that is hemoglobin A. So they are covered the first 1 year because they have now the hemoglobin F. But by the time now this one starts to take over, then now the symptoms starts to appear because the hemoglobin F is it's fading away. Now, the other thing is that when the child is young, they still have blood being produced in the long bones. These are long bone. It's short, but it's long.
I was just about to ask, what do you mean long?
The bones in the body are divided into the short and the long bones.
Okay.
So they are still producing blood in the small or the long bones of the fingers and the toes.
Okay.
So when you get these infarcts or these occlusions, you also get to have now the blood vessels getting to those bones also being clogged.
Okay.
So they become occluded, they become inflamed because of that. So that's where they present with something called dactylitis.
Okay.
So the ducts, the toes and the fingers. So that
Yeah.
like that symptom, don't expect it in adults because
Okay.
there's nothing going on in terms of what we call erythropoiesis in the hands and the toes. But in adults, we go back to the spleen, and now the bone, the long bones. There's not the flat bones. Yeah. So and that's why now the pain in adults is more likely to get what we call acute chest syndrome. They will have a very bad chest pain because these flat bones here, they're still producing the red blood cells. They are producing blood cells. So what we call one of the key presentations is what we call acute chest syndrome, and that's no more. It can affect both now the young ones and the adults.
Okay.
Yeah, that's the only difference where there could be a difference in the way the presentation is. But all the other things, they are almost generally the same.
Okay.
Yep.
Is there a way that one would prevent their baby from getting, sickle cell? Assuming I know I have sickle cell, and as you've said, it's hereditary. So there's a very high chance that my baby would get sickle cell. God forbid I don't have. But for anyone who knows, either them or their partner, they have sickle cell disease, is there a way that it can be prevented from, it being passed on to their kids?
First things first. For a child to be born with sickle cell, both the father and the mother, they have to be carriers. They have to have the trait.
Okay.
If I don't have, and you have a trait, there's no way that's going to happen.
Okay.
So for the child to be born, both parents should be carriers.
Okay.
And even for the both parents being carriers, not all the children end up with the sickle cell. 25% they will have normal.
To be clear, okay.
Hemoglobin.
Yeah.
50% they will be carriers. Only 25% who can suffer the sickle cell. So how do you prevent that? Now, to prevent sickle cell is to do what we call genetic counseling.
Maybe before we even go to that,
Yes.
how would you know that you are a carrier and you don't have symptoms?
The only way you can do is doing lab works.
Okay.
What we call electrophoresis.
All right.
Yes.
So it's important.
That's when now the genetic counseling comes in. Like you do a premarital counseling, you're told it's good to do screening for this. Of course, if you come from those areas we've mentioned and all of both partners are coming from that area, it's important to take that step. We have agreed that we need to move on. You can do what we call now genetic counseling. Then now you do go for the test. Then you'll be able to be told that if you are a trait or you're a carrier or your partner is a carrier, and now from there you can decide what you want to do with your life from there onwards. Of course, but it's important to make a decision from the point. So that's the only way you can prevent that, again, because it's a genetic thing. Yes.
Okay. Now explain the prevention part.
The only prevention is that. The only thing now we can talk about is it has already happened. We have the sickle cell. Now what can be done in terms of the management of patient with the sickle cell, and as I said, sickle cell, there's a lot of presentation, a lot of symptoms. We need to know what are the triggers, because for the patient to be able to take care of themselves, to be able to reach that life, because there is a problem in diagnosis. Most people are getting to know about the sickle cell disease late. So the first thing is screening. The first thing, if you have a high index of suspicion, the first thing is that when the baby is born, they need to be screened. So that now you can be able to know what to expect, right? Because with that, now you know what to look for, those things that we've talked about, and what needs to be done. Because, again, as I've said, there is no specific treatment, but we know we can alleviate the symptoms and prolong the life of this person who is having sickle cell. Because now when you have sickle cell, there are things that now trigger the symptoms. And now the main thing, and that's why I was telling you initially, is that these are not a condition that you'll be left to the daktari to manage. Hii ni kitu tashughulikiwa na mgonjwa na daktari. Ukuje kwangu nikwambie this now a child has sickle cell. Nikufunze sickle cell nini venye tumefunza. Then I'll tell you there are several triggers. Ama kuna vitu ambazo zita trigger those symptoms. Those symptoms, basically these things and the triggers, what they do is that they affect now the shape of the red blood cell. One of the triggers is anything that is going to reduce the oxygen concentration in the body. What we call hypoxemia. Right? So anything that is going to reduce oxygen concentration in the body, you need to run away from it. Number 2.
So that would include what?
Maybe you story ya jiko ile tunasemanga ama uingie mahali penye it's not well ventilated, or you get an infection or the respiratory infection that affects your breathing that will lower the oxygen concentration in the system. Of course the pneumonias and that. If you get to avoid those things, then you avoid that part of hypoxemia. The other thing that triggers crisis, because most of these patients will come in crisis. Yes. So the crisis, the most common one is a painful crisis. We have talked about the pain, the bones, the chest, the abdomen. The other thing is dehydration. Ama kukosa maji kwa mwili, right? So we encourage them to take a lot of fluids, especially when it's hot. We tell them now, take more water, avoid the dehydration, because dehydration will trigger that the crisis. The other thing is infection. Any form of infection, talk about pneumonia, talk about typhoid, talk about malaria. All those ones now will trigger the crisis. So we need them to avoid, to prevent the infections. And the way to prevent the infections is very simple. Kama ni malaria, sleep under mosquito-treated nets. Kama ni infections, pneumonia and we usually, it's recommended that you give prophylactic antibiotics for up to an age of 5 years. Then the other thing is, of course, for depending on the case, there's a drug that we give that usually boosts the hemoglobin F in the system, so that you avoid the hypoxemia. The other thing is fever. Anything that is going to raise the body temperature, then you need to avoid it. So those are things now we teach the clients or the patients, so that wanajua mimi na joto ikiongezeka unaanza kunywa maji. Ukisikia kama unakoa kidogo, kimbia hospitali, daktari ya kuangalia, kupatia dawa na mapema, because the more you get, if the infection sets in, now it will trigger all those other things. Yes, the crisis, and that's what we want to avoid. Yes.
I love how you've explained it, that it's not only the doctor, it's that as the patient as well, you have to know what to do and what not to do. And that is why we're saying that there's your part to play as well. But as you said, there's so many ways on how you can prolong the life of this particular person and how you can live free of pain. So we'll be talking about the treatment part, but I see we are short for time, so we'll be taking a very short break. As we come back, we'll be talking about the treatment and we'll be continuing with the discussion. Also, we'll be reading your feedback. So if you have any question on the same, we said our numbers are very open. That is 0721-105-105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. Our social media pages at MBCI TV, Facebook page, YouTube page, and Rachel Kahugu on all social media pages. Let's take a very short break. We'll be coming right back.
MBCI Television, transforming lives.
Unasikia wengine wanasema mimi nataka mwenye ako na six pack. Unajua unakuta Mwangicho Mola ameumizana na machuma akitafuta six pack.
Majadiliano kabambe katika Biblia na maisha. Juma hili tutazungumzia nini? Jumuika nami Enaeli Mlenga na mwenzangu Mangicho Mola. Alhamisi hii saa 1:30 hadi saa 4 asubuhi. Papa hapa MBCI Radio, na wakati huo huo MBCI TV. Barikiwa.
Nakuru County ni county number
27.
Nataka unikamilishe medali mtaka cha mvunguni.
Sharti ya iname.
Atekae maji mtoni.
haiwezi mwagika.
You not get work, abi?
Atekae maji mtoni?
Hapo sijui.
Inakaa kuishaje? Atekae maji mtoni?
Yanaenda kumwagika baadaye. Yamwagikae baadaye.
Nataka urudie mara 3. She sees cheese. She sees cheese. Rudia mara 3 mbio mbio.
It's about to go down.
She sees cheese. Highway inaitwaje kwa Kiswahili? Highway.
Hapa sitaweza.
Highway. Yes. Ni njia ile banda. Njia banda.
MBCI Television, transforming lives.
Perfect. We're back after that very short break. Thank you so much for staying. As we said before, this is Afya Clinic, where we talk about everything health. And of course, you're getting us on MBCI TV, ambapo tunabadilisha maisha by the grace of God. My name is Rachel Kahugu. We'll be here up to 10 in the AM. Thank you so much for sticking around. I know that you're getting something from today's discussion. Today, we're talking about sickle cell disease. And we have seen that there's good sensitization. People know about sickle cell disease. Dr. Amesema he is impressed. So let's continue doing that, because this is the month where we raise awareness about sickle cell disease, what it is and how we'd be able to just, live well and in a very healthy way, even with the sickle cell disease. It's very important for us to keep talking about it, share such links where we create awareness, because that's also very, very important. Thank you so much for staying. We'll be talking about the treatment and management of sickle cell disease. But before we do that, we have the healthy living segment, where we get to know about how to continue living very healthy. Yeah, that's tumeletewa na Sylvia Wanja. So let's get that. We see how to continue living in a very healthy way.
Hello and welcome to Health Matters Today, where we share tips, stories and advice on living a full and healthy life. My name is Brenda Kareji. Today we are focusing on a condition that affects millions around the world, yet is often misunderstood: sickle cell disease. Let's talk about how to live a healthier, fuller life with sickle cell. Whether you're living with it, caring for someone who is, or simply want to learn more. Sickle cell disease is an inherited blood disorder. It affects the shape of red blood cells, making them stiff and sickle-shaped instead of round and flexible. This leads to blockages in blood flow, leading to pain, fatigue, and sometimes serious complications like organ damage or stroke. There is currently no universal cure, but with proper care and healthy living, individuals with sickle cell can lead longer, more active lives. Healthy living tips. Now, let's dive into practical healthy living tips for managing sickle cell disease. Number 1. Stay hydrated. Water is your best friend. Dehydration can trigger sickle cell crisis, so drinking plenty of water daily, at least 8 to 10 glasses, is essential. Number 2. Eat a nutritious diet. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Iron-rich foods and folic acid supplements may help with red blood cell production, but always check with your doctor first. Number 3. Gentle exercise. Regular light exercise like walking, swimming, or yoga improves circulation and reduces stress. Just avoid overexertion and stay warm during workout. Number 4. Get enough rest. Fatigue is common in sickle cell. Make sleep a priority. Aim for 8 to 10 hours a night and include rest periods during the day if needed. Number 5. Regular checkups. See your doctor regularly. Vaccinations, screenings, and routine blood work help prevent infections and complications. Early treatment is key. Number 6. Take medications as prescribed. Whether it's folic acid, pain relievers, or medications like hydroxyurea, always follow your treatment plan closely. Number 7. Manage stress. Stress can worsen symptoms. Practice stress-reducing activities like breathing exercises, journaling, prayer, or spending time with loved ones. Living with sickle cell isn't easy, but with knowledge, care, and a supportive community, it's absolutely possible to thrive. Let's keep spreading awareness, showing compassion, and supporting those affected. Thank you for joining us on Health Matters Today. Stay healthy, stay hopeful, and keep living strong.
Perfect. So that is it, and as you've seen, it's very important. And let's keep spreading the awareness. I hope we won't forget that, right? Now, Doc, let's talk about the management. for someone who has the sickle cell disease, what can they do to just make sure that maisha inaendelea vizuri?
I like the segment that has just ended because it just summarized everything.
Yeah.
Yeah, but I will elaborate on that. It started by saying that it's not definite cure as of now, though there is what we call gene therapy. Gene therapy means you can have some bone marrow transplant that can change the cause of the disease, that can cure that disease. The challenge is that it's not readily available locally, and even for those advanced countries, it's still a challenge. So we cannot talk about it right now. We'd better talk about what we are able to do in our capacity. And as I said, I mentioned the triggers. The best thing is to understand the triggers that are there. Then you avoid them. That anything that's going to reduce your oxygen concentration, avoiding dehydration, as Rachel put it very clearly. And of course, you're working. This is now the part of the patient, but it comes to the part of the clinicians. We also need to be able to identify those infections as early as possible, and we do what we can do even to prevent them, the triggers or some of these things that will trigger like the infections. And one of the things that we are advocating for is vaccines. Vaccines are good. They help prevent a greater percentage of some of these infections. For example, we talk about pneumonia. Pneumonia, of course, it affects the lungs, it will affect the oxygen concentration. That's one key. So there is one thing that we can do for that vaccine for pneumonia, what you call pneumococcal vaccine, which is available. Also, we have salmonella that causes typhoid. We also have a vaccine that is available. So we can give this, and the clinicians or the doctor will be able to advise the right time and how it is supposed to be given, but those things are some of the things that can be done. Number two, identifying those infections as early as possible and treating them. The other thing that the part of the doctor will do is that if the anemia is too bad, of course there is transfusion. The transfusion will boost the HB and also boost with the right hemoglobin for some time. Again, it's not a regular thing, but again, that will result from the evaluation by the doctor and the things that you need the transfusion, then that will also do. Supplement folic acid. It's very important in forming the red blood cells, or the production of the red blood cells requires iron and folic acid. And remember, as I said, you're breaking a lot of red blood cells, so you're likely to be having enough stocks of iron, because once the hemoglobin is broken down, it will be broken down to hemoglobin, to iron as one of the components, plus the other components, of course. That's why now we need the folic acid in, and if you listen to that segment to talk about folic acid, because now the folic acid with the iron that you already have, they will be combined and help in producing the red blood cells as required. The other thing that I said is that we need to prevent malaria. Of course, there are some medication that we give for those people who are living in those endemic areas, and of course sleeping under nets, so make sure that you don't get regular infections. The more you avoid those infections, the malaria and the bacterial infections, the better. The other thing that we are doing is giving something called hydroxyurea. And as I said, hydroxyurea usually boosts the production of what you call hemoglobin F, the fetal hemoglobin. And now, when you have now the normal hemoglobin and the hemoglobin F, they usually counter the effect of the sickling. They prevent the sickling of or even the abnormal ones. So you already you are having enough HB to carry the oxygen. So those are some of the things that can be done in terms of management, and as again, to mention that clip, exercise, because you're likely to have those joint pains, the stiffness, because of, when you're sick and you lie down for several days, of course, those joints will become stiff. So exercise, again, it's very important. And of course, now the diet or the nutrition part, making sure that you're taking foods that are rich in folate and basically vitamins, because they detoxify the body, and that way you can prolong the life of this client or the patient who has sickle cell.
Okay. I love that you mentioned the exercise part. because most people hapo kwa exercise is where they draw the line. They say mimi nitakula tu vizuri, I will do all that I need to do, but exercise kidogo daktari, surely. But when you talk about exercise, what exactly are we talking about? What kind of exercises would be good for this particular person?
For the person who has sickle cell, it's not the extreme strenuous exercise. And if you had in that clip, I talked about non-exhausting, yoga, swimming, those are exercises, but not extreme. Not that one. So not going for the weightlifting. Of course, you go to weightlifting, that's exertion, and now that can even now reduce your oxygen concentration. Or running 100 meters or 10,000 10 kilometers. Those are a bit strenuous. But jogging, swimming, those are stretches. The aerobics, just minimal aerobics, that's good enough.
Okay.
Yep.
Perfect. Now, we'd love to unpack some of the myths and the misconceptions that surround this particular disease, sickle cell disease. And for that, we have some mythbusters, but also you'll be adding to it on what you've had because you've treated people with sickle cell before. But for now, let's get the mythbusters so that we just get to understand what are some of these myths and misconceptions. The first is that only black people get sickle cell disease. Surely we have so many questions, but tell us.
No, it's not only black people. It's only that we have said that the sickle cell disease is prevalent in the tropics. The tropics, remember, most of the black people are living within the tropics. So it is not only the black people who get the disease, but majority of those people, yes, they are black because of the location.
Okay.
Yes.
Okay. Perfect. And the second one is that sickle cell disease is contagious. Is it?
I think I started by saying that is not contagious. That was almost among the opening statements. That being close to somebody who has sickle cell cannot make you have sickle cell because it's an inbuilt thing. It is in the genetic makeup. So even if I'm with you, tunafanya kazi na wewe, hakuna venye utapata sickle cell contagiously, no way. It has to be inherited. Yes.
Because that has also caused a lot of stigmatization around sickle cell.
Yeah, the reason why I like the awareness. Because we are going to demystify some of these myths. It is not contagious.
It's not.
Yes, not
at
all.
So please help these people. It's important. The third one is that people with sickle cell disease cannot live long or productive lives. Why? Especially the part of productive. They're very productive.
I have a client who I'm following who is very extremely productive in building this nation. I've been following that client for more than 10 years. So there's a challenge. There is some truth in that statement that the prognosis is not usually very good if appropriate care is not taken. The research has shown that most of these patients who get sickle cell, if nothing is done or the right thing is not done, getting to their 5th birthday is a challenge. 5th.
Okay, that's really short time.
5th, it's very short time. So there is some truth in that statement, but it is not entirely true because with appropriate care, early diagnosis, comprehensive care, the one we are talking about, that encompasses every other person. You explain to the patient what they need to do, what they need to understand, the people are taking care of that. Is psychological support, nutritional support, or then the medication, all those things, if they are done well, these people can live to see their adult life, and they can live a productive life. As I have told you, I have a client that I've been following for a very long time, and he's a very productive person, I can say, and I know where he's working. So
he's very productive.
Very productive in building this nation. So, and the beauty about it is that that client, this particular client, I usually like him very much because he's a guy. He knows those things. He knows when to rehydrate. He knows when to. He can call me anytime. He feels like kahoma kidogo kana daktari he's in the clinic. He's the one who doesn't like wait to get into those to the extreme. So that aspect of the awareness, and that's where the awareness now is very important. If they are aware, the triggers and what to do, then they live a normal life.
That's good.
It's manageable.
So as you've said, if you know you have sickle cell, usingoje iende mbali. If you have any symptom, that's when you call the doctor immediately.
Yes, right away.
Immediately. That would be very important. And the last one is that sickle cell disease is the same for everyone who has it.
That's not true. It's not true because again, the severity it's not the same. Yeah, there are people who have sickle cell and they have lesser severe symptoms than the others. So it's that's why the management and the care, it's highly individualized. So this person has to be evaluated and has to be followed up. The key thing here is close follow-up. So that you'll be able to know any changes, you be able to pick them and take care of them appropriately. But it is not the same. The script is not the same. Because if you say the script is the same, then we'll say every other person at 5 years, gone. Yeah. No, I have seen people who are gone.
Who live
normal life. And they're adults now.
Yeah.
But I've also seen the others. So the key thing here is early detection, early screening. If you're able to do the newborn screening, then you'll be doing a good job because we'll be knowing what to anticipate. But the moment we get into the complications, then it becomes very hard to manage. You are coming there, you already have necrosis of the head of femur because we're not getting blood supply. You are coming there, you already have stroke because of sickle cell. You are coming there, you have already had heart failure because of sickle cell disease. It's a bit late. And because now you'll be dealing with the sickle cell and the complications that are as a result of the sickle cell disease. But if you're able to take care of those things that I've said, then you avoid those complications.
Okay. Now, what are some of the other myths that you've encountered, especially from the people who live with people who have sickle cell disease?
The most common one, ni uchawi.
Yeah,
of course, in African setting, everything that does not seem to make sense, we like concluding that ni uchawi. And again, there are those who still think like because you're having a sickle cell, you're not supposed to have a normal life. Like you'll be treated like kama outcast kidogo, like kama unafaa kuwa na dunia yako peke yako. Again, that is not true. If you have sickle cell, you can have your normal life. Or near normal life as much as possible, as long as we are able to do what we need to do at the right time.
Any other?
None. Again, it's not okay. We are saying it's there, but around here in Nakuru, not so much. Not so much. But I know those people who are in Western and in Nyanza and coastal region, they can relate, and they might be having more myths than us. Because what we have in Nakuru is it's what has come. It has come in because of influx from people coming from those areas.
So if you're there and maybe you've heard of a myth that you haven't talked about yet, and you'd want to demystify and tell us that no, inimesikia, but I don't think it is. So also share with us. Our numbers are very open for that. Love to hear from you. That is 0721-105-105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. On Facebook, on MBCI TV Facebook page, you're live. On the comment section, we'll be able to get your feedback, and YouTube as well on MBCI TV official YouTube page on the comment section. And of course, on all social media pages at Rachel Kahugo, I'll be able to get your feedback. And I know that as we continue, we'll be able to get tips or more of a recap of what we've talked about today. So if you've just joined us, usijali, we will update you on what we've talked about. But still, because we are live on Facebook and YouTube, you can always go back and watch, and also just share the link, because you said that this month we raise awareness as much as we can about this particular disease. Now, what is something that a family or friends of this particular person who has sickle cell disease, what's something that you would tell them? How are they able to support this person emotionally, and just to be there for them?
I talked about the psychological support as part of the comprehensive care. I mentioned that. And you see now, when it comes to psychological support, there is no psychological support without mentioning the friends, without mentioning the family. One of the things is that they are supposed to encompass them. They're supposed to show them the compassion that they need. They're not supposed to treat them like they are somehow awkward people in the family or in the society, because now they understand that this is something that can happen and can affect anybody, and it's not going to affect them because they're being close to them. Then also give them that moral support, like if it's about exercises, can join them in doing exercises. If it's about nutrition, you can help them in terms of nutrition. You know, you could be having these which we're talking about. For example, you need a good nutrition, the fruits and the like, but this person is challenged financially. They can't even afford fruits. There are people in this country who don't take fruits because they take it as luxury. See, so if you have that kind of a relationship, if you are your friend, you're to a person who has a sickle cell, just love them, show them the support that they need. Be there for them when they need you, and you know what they need to do now. We have talked about the triggers. Even if it's just taking them for exercise, just take them. It means a lot. You meet them and you visit them with a cup of or a bag of fruits. It's very important. It will make a very big difference. Then you involve them in activities that are in the society, so that you don't feel like wewe ni mgonjwa haufai kuwa hapa, hapana. No. That aspect of encompassing or putting them in every or bringing them close in terms of activities in the society or in the family, then it makes them now not feel like they are outcasts. Anything that is going to make them feel an outcast is what will now bring them down very fast. So that's what the family and friends can do.
That's very important.
And social support,
that's very important. And I believe with that is that also itende kimaliza the stigmatization that is around sickle cell disease. And maybe this is just the right place to mention that we have people who are championing this, even in the internet, and we've seen it, and they're doing an amazing job. Kinakayet, it's good to mention. We've seen what they're doing, and just to come out and say that it's true, I am suffering sickle cell disease. This is what that looks like. And this is what you should do to support people like us, that it's not an easy journey, but people are able to go through it and live very healthy. So if you're there, and maybe you're suffering from sickle cell disease as well, maybe you just take that opportunity for you to be also a champion of sickle cell disease, to allow other people to know what that looks like, and support the people who are going through the same disease as well. But we've said that you can live a normal life, or as Doc, you said, a very near to normal life, even with the sickle cell. It's not wrong. It's very right to just know that you can be a huge supporter of this particular. And you're saying that because this is the month where we support and we raise awareness as much as we can, because that's very important. We have questions that are coming in comments, but we might not be able to go through all of that. We just try to go through as many as we can for now. And I'll just start with let's just see, we have Petero, Jeta Petero. I see you, God bless you. I see you following. We have Mwangi Wairago. I see you. We have Evangelist Gilbert. I see you. You're following from Kilgoris. Mnasema that you are learning a lot. We have Kwapi. Right. We have Vicky. And Victor is asking, I had thought about this question, but I said no. Victor is asking, is it something that you can outgrow as you continue? Once you have sickle cell, that's it?
As I said, it's not that you can outgrow. That is something that you need to accept, that you're going to live with it. So that you can take care of it the way it's supposed to be taken care of. So you cannot outgrow sickle cell.
So lazima ujue vile kuishi nayo. And be able to live with it well.
Exactly.
Okay.
You cannot outgrow it.
May God, I pray that God will help us, that, we'll be able to live well. But also if you have sickle cell, we pray that, there's the part of miracles as well. Pray that will happen. But for now, because we have doctors, that's very important. Doc will be getting your number. I see we have people who are asking for your number and contact and where they get help. We'll be doing that in a very short while. But we have tips that we'll be talking about tukimaliza, so if you've just joined, I see that some of the questions ambazo zimeulizwa, there are things that we've already talked about. So I just encourage you, we've been live on TV, on Facebook and YouTube. So on Facebook and YouTube, you'd go back and you'll be able to hear the conversation right from the beginning. So you'll have all your questions answered. If you'd love to share this link with your friends, family, it's available. It's available on Facebook, it's available on YouTube. You'll be able to do that. Now, Doc,
Yes.
what would be your parting shot on this particular discussion?
What I would really want to say or to emphasize is the awareness. That is the key thing. I wish everybody could be aware of sickle cell disease, because now being aware means that a lot of other people are going to learn, and the people who are suffering from the sickle cell disease, they are going to get the appropriate support. That is a key thing that I would want to, or the information that I would wish to pass across. That let's support those people who have sickle cell disease, so that they can have a near normal life as much as possible.
Yeah.
It's possible.
Yeah. How bad would it get? What's the, for, in your experience, what's the complication that you've seen for people who've just decided, what's at one, how bad this can get? And I know most of the time it's usually that they don't have the knowledge of what to do, and it's sad.
Yeah, the sad part is that if sickle cell is not taken care of, losing of life, it's imminent, it's unavoidable if it's not taken care of with the care that is supposed to be taken care of. It requires a lot of effort from both the clients or the patients and the doctor. That's why I'm talking about awareness, because the moment everybody or the people are aware of it, then the easier it is to get to take care of them. So the worst case scenario is that if nothing is done, the loss of life. That's what is likely to happen.
Okay.
Yeah.
Now, for the people who would love to reach out and get help, what's your number? Unapatikana wapi? You in Nakuru? You in Nairobi? You know, Uganda?
Yeah, of course, we're in Nakuru City. Very readily available. My number is usually says public. I should put it on a billboard because I usually don't mind getting calls any time of the day. The number is 0727 365 217. For those who are in Nakuru, they can find me at ClearScan Medical Solutions. So we are located at Lydia Arcade, first floor, room 105.
Okay.
Yes, and we are open every day, Monday to Saturday. Yeah, and we are available on call.
Okay.
Yes.
Perfect. So the number is on your screens. I know that we'll be getting it. So the number is on your screens, and if you get help, if you need help, you can get help. He said that he's readily available. Monday to Saturday?
Yep.
Okay. The whole day?
The whole day.
8 to 5?
Anytime.
Anytime. Sawa. So you can always call, and you know that you'll get the help that you need. Apart from the topic that we've talked about today, there's so much you do about scans. Maybe we can talk about it in 1 minute for anyone who would love that service as well.
Yeah, there are other specialties that we do at ClearScan. As the name suggests, ClearScan. We like doing very clear ultrasound scans. Basically, it's an imaging modality where we're able to diagnose a lot of things. Of course, when people hear about scans, they only think about obstetric scans. I'm a scan ya mtu mwenye ako na mimba. I like demystifying that myth every time I get the opportunity that scans are not only for pregnant women. Scans are for every other person because there are so many things that we can do. But of course, with emphasis on obstetric ultrasound scans, which I've seen it making a very big difference in terms of the lives of the patients and the unborn babies. So we do a wide range of ultrasound scans, basically the entire range that we will be discussing maybe in the next discussion. But they can also visit our page, ClearScan Medical Solutions. We have a page there as with the information of all the scans that we are able to do, and even they can also see what we have on WhatsApp. So the information is available online, so they can see everything that we're able to do.
Okay.
Yeah.
Affordable prices?
Yeah, of course. I mentioned affordable everywhere. Affordable and reliable. I like using that word, affordable and reliable. It can be affordable and not reliable. But the prices are affordable for the service that we give.
Okay.
Yep.
Perfect. Works well. Thank you so much for that. Tutakuwa tunamalizia hapo sasa for the discussion, but we'll be getting the tips. I don't know if they're ready yet, so that we'd be able to, so that we'll be able to just get to understand what exactly we have talked about. Now, those are some of the pointers that you've had since you started today. Na sasa kwa sababu unajua lazima tukule carrots here and there so that we'll be able to do that. Let us go through them. So these are some of the pointers or discussions that we've had today. And this tells you that if you've not been able to join us from morning, you can always, from, we started at 7:30, where we started by music and then we got into the discussion. If you weren't able to join us from 10, of course, that means that you'll be able to just get what we've been discussing. But as we said before, is that you can always go to our social media pages where you can get all that information. Ukae tu watch kutoka mwanzo, and that will be very, very important for you. Okay, now let's go through some of the topics, as you said, or the pointers, rather. We started by saying that sickle cell is a genetic condition, and that means that it's hereditary, so you get it from your parents,
Sure.
right? Yeah. And we also say that there are some people, sickle cell traits. There's some people who have the traits, but they're not sick.
They don't suffer.
Yeah,
they don't suffer the disease, yeah.
Yeah, so they're only carriers.
Those are just carriers, yes.
So the only way they can get to know if they're carriers is through the scans, yeah?
That's through the lab works, what
The
we call
lab work.
electrophoresis, yes. That's
Okay.
a lab work, yes.
Okay. And you also say that for a sickle cell person, the red blood cells are sickle-shaped. Therefore, it's not able to carry enough oxygen.
And move through the blood
And
vessels.
yes. And the sickle is watu wanaijua sana kama ile ya kukata nyasi.
Ndio hiyo.
Yeah, that is what
very
that
nice
looks
image.
like, or you've seen it on your screen. So that is what that looks like. It's not able to carry enough oxygen, but also not able to move through the blood vessels as it should. And we also say that some of the most common symptoms include anemia, the crisis, which is pain, which is acute pain, very
severe pains. One of the most common crises is what we call the acute chest syndrome.
Yeah.
We also have the anaplastic crisis. The splenic sequestration.
Yeah.
So those are some of the crises that usually occur in sickle cell disease, yes.
Okay.
Yeah.
For the stunted growth, inaonekana sana kwa watoto.
The stunted growth, that means that this is what you'll be able to see as a sign. The child is not growing at the rate at which they are supposed to be growing. So of course ni watoto wadogo. Uta notice huyu mtoto kuna vile akamei kama kameekelewa kamawe. Then you start thinking, or the weight. You see, we see it starts showing at 6 months to 1 year. So you realize that when you go to clinic, this baby is not gaining weight, because that's how we know the growth is getting stunted in very young ones. So ukimpeleka clinic, and that's why it's important to take the child to clinic. Akipimwa kilo, unaambiwa hey, mtoto wako, unasema mtoto unalisha vizuri, kwa nini haongezi kilo? Then now you start thinking, could this be anything else more than just feeding? Then you're able now to do the screening, and then the screening will lead you to maybe now you discover now this child has a sickle cell. Of course, we usually say that as clinicians, you have to have, your mind is always open. When you see something or you are talking to somebody, you are thinking about every other possibility, so that you can come with all the differentials, then you narrow down and you're like, oh yeah, ndio hii.
Okay.
Mtoto umelisha vizuri, ananyonya vizuri, vaccine amepata vizuri, lakini hakui. Think outside the box.
Yes. Okay. I had a case like that the other time. And we just said, labda tu ni appetite yake. Labda tu ni appetite imekata. But, hey, we need to get checked.
Seek help.
Just to make sure that we are not ignoring anything. Yeah. We also say that people with sickle cell anemia have low red blood cells because they are distracted, or they're destroyed at a higher rate than they are.
Exactly. As we said that, I told you a red blood cell has a lifespan of 120 days, but you'll find that these ones which are sickled, they might not even go beyond 20 days.
Yeah, 20?
Yeah.
I was thinking of like 100.
No, it's very short.
That's
very
short.
Yeah, once it's sickled, the body detects it's abnormal.
Yeah. Oh, okay.
Inamalizana nayo. What we call,
Okay. We also say that genetic counseling is very important for a couple so that you'll be able to know if you are a carrier or not and be able to make a decision from there. We also say that there is no current treatment for sickle cell, but gene therapy would help change the course of the disease and just help you manage it even better. We also say that supplements like iron and folic acid can be used to manage the disease. And the last for this particular segment that we have is that sickle cell disease is most common in the tropics.
Yeah,
and it's because of malaria.
And in our case, Nyanza, Western, and the coastal region.
Yeah.
Those same areas where malaria is prevalent.
Yeah.
It's endemic,
Okay.
Yeah.
You know, as you explained it, I just realized that God created us in a very unique way. Our bodies will just decide, wacha to fight malaria, wacha to fight this and that.
Yeah, then the mutation comes in.
Yeah.
Yeah. Now, God did a
like
marvelous thing when He created the human being, and I love medicine. As in, it explains some of the details that when you think about them, then you think about how marvelous God is.
Yeah.
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 If you just want to see how marvelous God is, just think about how the body works. That's the physiology. I love physiology because that's what explains to you how does this work. Yeah, you see, and the reason why I told you I enjoy doing scans when you're coming there, you're having a baby there, is growing, then somebody asks you, "Asa mtoto anapumua aje akiwa huko ndani?" You see, you're doing a scan, you're seeing the baby there is moving, kanarusha mkono, kanafungua mdomo, kanakunywa maji, you're like, you mean you're able to see these things, all of them, and then you realize, that's how great God is. It's marvelous. You cannot explain. You cannot explain who God is. Because when you see some of these things, then you realize, it's beyond your understanding. It's beyond, as much as we know what is happening. But there are so many things. Medicine is so wide, so broad. So if you wonder if God exists, just look at yourself and ask yourself several questions.
Yeah, maybe if you're wondering if God exists, surely just look at yourself and just know that He does exist. Because how would that be?
Exactly.
It's out of topic, kidogo, but I knew for sure I couldn't be a medic because I can't stand seeing blood. But there's one time I went for a postmortem. And goodness, I just left there telling myself, I think we just don't understand enough what the inside of our bodies look like. There's so much going on in our bodies. And when the medic is explaining to you that, the heart is covered by, what is that? That it's covered by what? It's so much that goes on in our bodies, and you just appreciate God more because of how your body looks like, and just that you can move while healthy each and every other day, because really, our bodies can just decide, tumechoka.
Can I surprise you?
Yeah.
You said that you can't stand blood. The first time I encountered a lot of blood, I almost fainted.
Easy.
That tells you that we are human. All of us are human.
Yeah.
We react to these situations the same way. Again, the first time I encountered, I was supposed to certify that somebody has really passed on. It was very difficult the first time. But you do it many times, then it gets to you, then you're like, okay, I'm not doing it out of, if your thinking changes, I'm doing this to help. So you block this first part. So not everybody can become anything.
Yeah.
So you can also, because
that's an encouragement. But
it's the truth.
Me, I still have PTSD of the postmortem. Kama kuna therapist huko nje tafadhali saidia.
There are so many.
I think
but it's a matter of what is the goal? What do you want?
Yeah.
As I was telling you, the first time I encountered a lot of blood, it was not easy for me. But with time, it comes to you, and then you get to adapt to the environment, and then it becomes easy.
Yeah.
I always making this joke. The first time we went to the morgue for anatomy classes, when we do the dissections, because we dissect every part. Every part. The first time you stand here when the body is there.
Yeah.
But by the time you are doing your final exam, nobody tells you to go there. You run there. You rush there to get the part that is easier to do the exam. So it's a matter of mindset and working towards it, and then it comes out nicely.
Yeah. I love what you've said, and this is an encouragement to everyone out there who'd want to get into the field of medicine, that you can always become anything that you've always wanted to be. So maybe uko kwa hii side yangu ya kufeel ni kama you cannot stand blood and stuff like that. But if it's something that you like, go for it. We've had Goshen here. It's a medical school in Makongeni. And they've been talking about training medics, because you need a lot of medics, actually. And they've been talking about training medics, and they say it every time. If you're there and you'd want to be a medic, go for it. Usiwache sisi tukwambie anything like you can't. No, you can. You can always become what you want.
Yeah, as a lecturer, I told you.
Yeah.
I've been lecturing for several years. And I do it out of passion. I do it out of the fact that I want to see more people getting help.
Yeah.
I can't be here. I usually give an example of where my mom is right now. Yeah. If my mom is feeling unwell and I'm here and I need my mom to be taken care of, how can I do that? Maybe kuna mtu ametumwa huko kwa hiyo center hapo kwetu, and I had the opportunity to train that person the right way. I ended huko, then I did not train that person, then I failed. So when I train, I feel good because I know I'm treating, as I'm here, I'm treating so many people everywhere in this country.
That's great.
Yeah.
That's
so
great.
I train you the right way.
Yeah.
Go out there, treat people
The
the right
right
way.
way.
It will be like I'm
That's
the one
great.
who is serving in those places.
Yeah.
Yeah. So
Oh, wow.
training is good.
Yeah.
Every opportunity appears, you train. Yeah, teach people. That's why I teach my patients, because I want them to understand what
To
I'm
also
doing.
understand what you...
Yes, like I scan you, I show you a baby.
Yeah.
Ndio hii kichwa, ndio hii mguu. Wacha kuniambia uoni.
Yeah.
I make sure
Ona.
that you see. You see what, and if there's a problem, of course, now it becomes even easier because I'm going to show you. These are cysts you're having in your ovary. This cyst measures this size. This is how it looks like. This is what needs to be done to the cyst.
Yeah.
If the baby is there and has issues, I'll tell you, your baby is unborn, yes, but has these issues. This is something that you can carry on with, or something that you can't carry on with.
Yeah.
And those decisions, I've seen them save a lot of psychological trauma to the patients. And that's why I told you, for me, doing scans is one of my passionate things that I love doing. I don't know what I don't do with passion.
Yeah.
As a farmer, I'm also a very good farmer. So
We'll talk about the sonography part,
yeah.
which is very, very important.
Yeah, very important, yeah.
That has been such a good way to close the show. And I know we still have the Did You Know segment, but I feel like we've already had many Did You Knows since we started. But tutamalizia tuna hii. So we have an amazing segment ambayo inaitwa Did You Know, where we get to just, learn something after we've had an amazing conversation and unpacking what sickle cell is. And, that has been so packed. So it's just to get us to relax kidogo. Yeah? So let's get the Did You Know segment as we wind up. So on today's Did You Know segment is that, did you know deaf people are known to use sign language in their sleep? Really? That I'll have to. You're a doctor. Have you ever had? Okay.
I also didn't know that.
You did?
I didn't know that.
Because I'm just thinking, how would you use sign language in your sleep?
I think the same day you might sleepwalk.
And what was sleepwalking now? We'll need to talk to them. Surely. That's different. But, okay. Yeah, maybe that's something we'd end up here where you do your research. Did you know that deaf people they use sign language in their sleep as well? Could be something. Could be something. Thank you so much for staying. Thank you for tuning in from 7:35. Well, we started with music, and I know that was a blessing to you. And then we started our discussion. We were talking about sickle cell disease to just understand what that is and how to manage it. And it was a wholesome conversation. I hope that you have learned something from that as well. Thank you so much, Doc, for joining us today. And you told us Clear Scan iko wapi exactly?
Kenyatta Avenue. The building is called Lady Arcade. When you come there, first floor, room 105, you'll find me there anytime.
Perfect. Thank you. I'll be seeing you on Friday on the Gospel Friday show, and of course on Saturday. But until then, God bless you. God be with you. Please remember, we are in the Prayer Festival week, which is one of our most favorite weeks, where we get to just bask in the presence of God, fast and pray and be happy. So make sure that you continue tuning in. Of course, we'll be having lunch hour, which will be starting from 12:30 to 2:30 p.m. But until then, God bless you. God be with you. Have an amazing rest of the day. Bye-bye.